whenever you have a small cut or an open wound, it doesn't heal like what we would consider as normal. It actually takes a long time for everything to heal well. So identifying it in the beginning to address it early is the biggest thing, I would say. One of the biggest reasons why patients don't heal with diabetes is diabetes causes these effects. One of the main effects that it causes, it affects your sensory system, so you don't feel as well. So if you don't feel, if there's something at the bottom of your foot, if you happen to step on something, you won't necessarily know if you're diabetic. That's the first thing. The second thing is that diabetes also affects your circulation, and it mainly affects your smaller vessels, not the larger vessels, but a lot of diabetics have small vessel disease, so you're not getting enough circulation to the area. And then thirdly, diabetics tend to have significant deformities. They tend to have increased pressures at the bottom of their feet, which puts them at risk for getting these wounds. Plus, if they're not very well controlled, meaning their sugars are not very well controlled, they're not seeing their regular primary care doctor or their endocrinologist, not getting proper nutrition, then it's just all of these forces combined leading to a wound and potentially even more disastrous, like an infection. So primarily for wound prevention really is thinking about managing or controlling your diabetes. And first and foremost, that comes with, following up regularly with your primary care physician or your endocrinologist to ensure that your sugars are well controlled. Because most of the time, if you're well controlled, the likelihood of wounds forming is quite low in general. But at the same time, prevention also includes checking your feet every day, which I think a lot of patients have a difficult time doing. Just simply checking the top of your foot, at the bottom of your foot, in between your toes, making sure there's no small cut, no small lesion. And if there is, then seeking immediate medical attention. The only thing about being diabetic is whenever you have a small cut or an open wound, it doesn't heal like what we would consider as normal. It actually takes a long time for everything to heal well. So identifying it in the beginning to address it early is the biggest thing, I would say. We have a wonderful diabetes education program at Emanate Health. We actually have a registered dietitian and then a registered nurse who provide education to our patients regarding appropriate diet, exercise, all of the potential effects of diabetes, which can potentially affect your eyesight, your feet. Obviously, the risk for amputation is high, your kidneys. So they go through a program with you individually and also in a class-size format as well, trying to help better control your diabetes. And I think being your own advocate and trying to control your diabetes is probably the greatest thing that you can do to help prevent any wounds, help prevent any amputation, and help prevent any complications that are associated with diabetes.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos. We upload informative video content every week.